Hello, this is Mr. Chicken. He's back, which is obvious because it does say my username below this video. And just call me Chris. I am known as Chris, just in case you guys didn't know that. Today's video is going to be about Sertaline. I'm going to give you a bit of an update. And as you can tell, this is a different packet, a different box. The doctors have decided to up my dosage on Sertaline to 100 milligrams. I think it's milligrams. mg. Yeah. What the heck is that signature? I do not know. But I decided to take this last night for the first time. Well, first time being on 100 milligrams. Bearing in mind I had been on Sertaline 50 milligrams for a month, and then he upped the dosage yesterday. I took my first 100 milligram dosage last night. I'm going to unpack everything now. I find it a bit weird how they've done this. Like, what's the point in that? Like, why cut everything up? Why can't you just give me a strip? Do they only do this particular company produce so many what do you call it, tablets in a strip, and in one strip it might be too much, and they just want to make sure that I take the right amount so I won't overdose or something. I don't know. But anyways, the tablets are bigger, obviously. If it's going to be 100 milligrams, it's obviously going to be bigger than the 50 milligrams. The 50 milligram tablet are tiny. These are a little bit bigger. Seriously. Not that big, but big enough. I wonder what the 200 milligram tablet's going to look like. Anyways, let's put it in the box before I lose them. Hiccuped for a bit there. But anyways, I want to talk about the side effects. I do feel nausea, like I do feel sick right now. I think that's because I just ate some food. It was cheese slices, dirty cheese slices on toast. Brown sauce, you cannot forget the brown sauce. But anyways, I'm going off topic here. I feel sick, and I felt sick yesterday, but I started to have balance problems. I can tolerate the drowsiness because I take it at 8:30 PM. Now I start to get really drowsy around 11 o'clock, 10 o'clock, and I fall asleep around about half 11, 12, maybe 1 or 2 the latest. That's because I'm fighting the medication I want to steal so I can talk to my girlfriend. But anyways, I get drowsiness, feel sick, achy, not all the time. I get cold hands, but that's because of might be because of my medication for my heart. Yeah. Also, it does make my mind go cloudy at times. But anyways, it's still in the early stages, and I'm a bit confused as to why I'm having balancing issues. I walk and I feel a bit unsteady. Apart from that, I'm fine. Anxiety, when I started to take the medication, first few weeks, I was anxious, obviously, and I had like panic attacks outside. Like one big panic attack. I just feel really trapped and vulnerable, and I didn't feel trapped, I just felt vulnerable and a bit too, yeah, I don't like open spaces sometimes, I just freak out. So I just go into a panic mode and run back to the house. I'm not as bad now, I don't think. I'm tackling that fear. I do have unusual thoughts. I feel like the drugs are dangerous, like the psychiatric drugs are dangerous. That's how I feel, that's what I think sometimes. But the doctors wouldn't prescribe me or you guys this if you didn't need it. It's only going to correct a chemical called serotonin, like correct that balance. Because people with depression find that they have lower serotonin chemicals, And what these medications do, these SSRI drugs, basically the SSRI basically stands for selective serotonin reuptake inhibitor. Basically, it tries to increase serotonin only in the synapse level and block the serotonin receptors from being reabsorbed and being used too much, because sometimes it won't make the signal when that occurs. It wouldn't like transport that signal to the next end of the nerve cell, to the other nerve cell. That's when you have depression, and this is supposed to correct the cause. And once you've done that, after a few weeks, it should remove your depression symptoms, most of your symptoms. And it's kind of like a numbing effect. It numbs your depression, and it treats it. I won't say it cures it, but it helps you to get rid of it. So with this in therapy, CBT, cognitive behavioural therapy, I recommend that. This Sertaline. It would help a lot. Oh, heck, I hate it. Anyways, wish me luck. I'm going to be on this for 2 weeks on 100 milligrams, and then he might up it even further. I don't know if I should be worried about him increasing the dosage. I probably refuse to go over 100 milligrams because I know I'm just going to experience something horrible, and if I know that, then there's a chance I'm just going to experience it because of that placebo. But anyways, I just rather stay on 100 milligrams as long as I can, and once I feel comfortable, I just feel like it's not making any effect, I'll let him increase the dosage. Like, why not? But the maximum dosage is 200 milligrams. But I don't fancy having any serious side effects. People need to weigh out the pros and cons. Only take the medication if you feel like you really need it and you're really struggling and you have no other option but to do this. And yeah, I know I'm saying I feel like I have no other option because my anxiety is really disabling. It is. I'm not just saying that, I don't want attention or anything, it's just, that's the way it is. Medication shall correct this mental thing. I can't even think clearly, but I hope I make sense to you guys that medication is there for a reason. And therapy, counselling are all there for a reason. If you're struggling, please go to your GP, talk about it, they'll put you on an SSRI drug, probably Prozac or Sertaline. Sertaline is basically Zoloft. Fluoxetine, that's Prozac, I think, and Zoloft, and Sertaline is Zoloft. I'm just telling you the brand names, but on the packet it says Sertaline. I think that's like the cheap version. But it's still too early to say if it's improving my symptoms. My depression feels like it's worsening a little bit. Anxiety is not great. My thought process it's slow. I can't really think clearly at times. But now that's when I'm struggling to come up with words. But medication reacts differently to other people, and I'm actually going to give this a good go, and I'll let you guys know what's happening with my medication and myself with this, so you guys will know the effects of the drug and you know what you're in for. So I'm taking these tablets for you guys, really, as well as for my depression, but I'm doing this I feel like doing that because kind of like an experiment. I might as well just try it out. I do have depression, but we're going to have a little bit of an experiment. If this doesn't work, we'll try other medication and do reviews on it. You know, it might make people feel better, because antidepressants aren't so bad. Yeah, once you get the side effects, you may get horrible side effects, but I heard that this is a wonder drug after when you get past the side effect stage. So wish me luck, and thank you for watching. I hope it made sense in the video, and I love you guys. Stay strong. Yeah. But before I go, these medications can help, but it's not a substitute. You can't just take the medication and expect depression to go away. You have to tackle your depression and anxiety, and this will give you a bit of a lift. It'll help you, and then you'll feel more motivated. You can try and help yourself a little bit further. If you are suffering from anxiety like myself, yes, if you experience anxiety and more depression at the beginning of the treatment, well, that's kind of a good sign. It means that your brain is responding well to the treatment, and your depression and anxiety won't be as bad if you keep taking this. Now, that's what I've heard from the NHS or other websites online, so it must be true. If you're experiencing depression and anxiety for the first a month or a couple of weeks, whatever, then that means you're responding to treatment, and you're less likely to experience serious side effects. Whether that's true or not, but I think it's different for people. It varies from person to person. Anyways, guys, like I said, I'm going now. Thank you for watching again. Just be cautious. Don't overthink it. Don't do what I do. Overthink. Google and be like, oh, SSRI drugs are dangerous, and the psychiatric industry are just wanting money. And well, yeah, they want money, but at the same time, they're not going to give something to us that will kill us. It might damage people's brains, but again, that's their brain. That they're in the minority. For those who experience deadly side effects, I'm in the minority. It affects 1 out of 10,000 people. I think a bit more than that, but seriously, it's very rare to die from that. You can't die from things. Make it, yeah. I suppose one of the side effects could be seizures or something like that. Or yeah, you can get cancer. It can cause cancer, but again, that is rare. Tell me something that doesn't cause cancer. Anyway, I'm ranting on again. Bye. Brain, just let me shut up and just leave these people alone. Subscribe. Just please subscribe and be happy. That's all I want.